Dr. Vaid. Now, what major pain points have you experienced with insurance verifications and prior auths?
Sure. So I can kind of touch on, how my experience has been in the practice. So I think, as I touched on before, prior auths take a lot of time, and we weren't able to handle those with the staff that we had. And so that was one of the main reasons we felt like we would try, kind of just like an outsourcing, because we were trying to handle those on our own, and it was just taking a lot of time. So doing that, we also, like, for us, we have our billing company doing our verification. So I can't really touch on that, but it is very, very helpful because every practice needs to verify someone's insurance if they're taking that, so that we know what people's co-pays are, and also if we accept that insurance. So I think, in certain ways, this has helped out quite a bit. And in terms of it also trickles down into patient care. Because before we weren't able to do the prior authorizations, we'd have the patients go to the pharmacy and then figure out what medications were covered by the insurance. And so now we have somebody who's handling that for us. So when I ask them, okay, what are the requirements for the medication to go through, they'll usually tell me, well, they have to try this medication before before they even accept it. So knowing that is really good information for a physician, especially because before I didn't know that. I was just kind of trying different medications and figuring out why isn't this medication covered? Is there some other medication that I'm supposed to try before? But sometimes I disagree with the insurance. But at the end of the day, they're the ones that are covering it or saying you need to try this, this, and this. And so I think it's really helpful to have somebody doing that.
Thanks for tuning in to Healthcare Talk Show.